need to have a strong deterrent. Removing that deterrent would send the wrong message to the people smugglers. That's why it's important we have the Rwanda policy. And Keir Stamer is saying he would get rid of that and remove the deterrent that we're putting in place.
And we're speaking now to the Health Secretary, Steve Barclay. Good morning to you.
Good morning.
Before we talk about, there's many questions to ask you, of course, about health. Keir Stamer has been talking about his plans to stop the boats, one of which is to have an EU-wide returns agreement for asylum seekers, the idea being that there's a quota. They help us stop the boats, and then we accept a quota of asylum seekers from the EU. Do you oppose that idea, or is there some merit in that?
Well, it's no surprise that Keir Stamer wants to give up control of our immigration policy to the EU and let them decide what quotas we have to take. And we're very clear we need to have a strong deterrent. That's why we put in place the Rwanda policy, and that is before the courts at the moment. But we're also reducing the number of crossings. They're down 20% this year, when crossings to the EU are up 30%. And that's because we put in place a returns agreement, for example, with Albania. That's seen a 90% reduction in the number of Albanians coming across on small boats. We're doing much more in terms of intelligence sharing, and we're investing in more measures upstream. So we're taking action to create a strong deterrent. What Keir Stamer is proposing is the opposite. It's getting rid of the deterrent of the Rwanda policy. It's letting the EU decide the quotas of what the UK would take, and that is giving up control of our immigration policy.
So you don't want a returns policy with the EU, because it's very clear that the process would be an awful lot quicker if people come through the EU to get to Britain. If we had a returns policy with the EU, that would make processing them an awful lot quicker, though, wouldn't it?
But if you look at the number actually coming into the EU, the scale of those numbers are such that it would require the UK to take a very high number as part of that quota deal. So, of course, if there was a returns agreement, that would provide a deterrent. But the cost of that would be letting the EU decide on that number. The volume of people, as I say, the number going into EU crossings are up 30%. And what the National Crime Agency has said is we need to have a strong deterrent. Removing that deterrent would send the wrong message to the people smugglers. That's why it's important we have the Rwanda policy. And Keir Stamer is saying he would get rid of that and remove the deterrent that we're putting in place.
And we'll hear from him just after 8 o'clock making that argument. Now, you're offering some more money to hospitals and trusts to help them through the winter crisis to come. Basically, the money is welcome, but the real challenge the NHS is suffering from this year is industrial action. And I wonder if you could tell us the last time you met with the junior doctors or the consultants, for example, to stop that industrial action.
Well, the BMA actually met just last week in terms of the specialty doctors. So there's a range of groups within the BMA, and we discuss both at ministerial level and at official level with them on a regular basis. But what we announced this morning is new money in terms of our winter preparation, but above all, in addition to that 200 million of new money, it's announcing measures much earlier so that health leaders have more time to prepare. We had the third of our summits in Downing Street chaired by the Prime Minister. That's the third time we brought health leaders together, working with them much earlier in terms of those winter preparations, looking at the lessons in terms of what was a very challenging winter last year. What are the key interventions that make the most difference? And then getting money out both to the NHS but also to social care much earlier so that plans can be put in place to make us more resilient going into winter. But you're absolutely right. So the consequence of the industrial action is extremely challenging. That's why we accepted the BMA's number one ask, which was for a very generous change in terms of pension taxation. The government agreed that. That's a huge uplift in terms of the remuneration of doctors. We also accepted in for the independent pay review recommendations. That means a junior doctor starting this summer is getting an uplift of 10.3%. The average for a junior doctor is 8.8%. So we've accepted the independent pay review body proposals in full, but we've also made an extremely generous offer in terms of the changes we made to pension taxation, and that is what the BMA said was their number one ask.
And just to be clear, when did you last sit in a room with a BMA representative to talk about the junior doctors' strikes? When was the last time you sat there negotiating? That's the sort of date I think people are interested in. When was the last time you were in a room talking about this?
With the junior doctors, it was on the 2nd of May. As I say, I met with the BMA just last week in terms of other doctors that we're in discussing. We've been very clear we made a fair and final settlement. The Prime Minister has set that out in terms of pay. Of course, we're open to having other discussions with the junior doctors and indeed the consultants, but we've accepted in full the recommendations of the pay review body, and we've also accepted the request in terms of changes to pension taxation.
But that was 4
we've
months
also got to get inflation down.
I understand that point.
And we've got to be fair to other workers across the public sector, whether that's nurses and paramedics, where we've reached agreement with them, over 1 million staff within the NHS, where, again, I sat down with them on a very regular basis. We reached a constructive deal with nurses, with paramedics, covering more than 1 million staff across the NHS, but the pay offer to them also has to be proportionate to what the doctors
I understand that, but I guess the point is you can't have a negotiation with someone if you're not speaking to them. If you've not sat down since the 2nd of May, that's more than 4 months ago. How can you get to a point where this is going to end if you're not actually talking to them?
Well, as I say, we've made a fair and final settlement in terms of pay.
But it's not been accepted.
The clear government, the government's position, but it's their demand is 35% stake. And I don't think offering 35% is fair to nurses, to paramedics, to those in our armed forces, to teachers, to others, both across the public sector, but also in the private sector. And we've got a commitment also as a government to get inflation down. That matters to all within the NHS and all across the economy. So we've got to be balanced in our approach. We've made very generous changes in terms of pension taxation that were the key ask of the BMA. We've accepted in full the recommendations of an independent process through the pay review bodies. Of course, if there's non-pay issues, we stand ready to discuss those. I met just last week with the BMA in terms of other discussions that we're having, but the government's position is clear that we have to bring inflation down, we have to be fair to others within the public sector, and the junior doctors' demand for a 35% pay increase is not fair or reasonable.
Let's talk about RAC in hospitals. RAC was obviously big news to do with schools a couple of weeks ago. It's also known as in the hospital estate. Do you, Steve Barclay, have in your possession a definitive list of every NHS building that has either a RAC or an asbestos problem? Do you know the scale of the problem?
Yeah, we've been looking at this since 2019. We've in fact had a £700 million investment fund to replace RAC since 2021 as part of a 4-year programme. Just earlier this year, I brought 5 additional hospitals where there were concerns with RAC into the new hospitals programme. I was actually criticised at the time for doing so because that has an impact of other schemes within the new hospitals programme. So we've been working through this. Of course, it's an ongoing process and we continue to survey in terms of the hospital estate because the Institute for Structural Engineers advice isn't that all RAC in all instances should be replaced. It's that we should be inspecting and monitoring the RAC, and where there's a deterioration, then we should be replacing it. And that's what we're doing. 3 hospitals have been fully replaced. We're working through a wider programme. We've had that £700 million of investment in place since 2021.
Let's talk about those 5 hospital projects that you've added to in May. The point is it not, that you were told about them back in 2021 when you were in the Treasury. You were told that 7 hospitals needed to be rebuilt. You decided to rebuild 2, and that 5, the 5 that you've now put in to the scheme, you could have put in back in 2021, and you've not done that. It's taken 3 years to do that. That's a good example of you should have dealt with that problem 3 years ago.
No, the spending review in 2020 was a 1-year review. The evidence was compelling in terms of the 2 schemes that were brought in. But what we did, in line with the Institute for Structural Engineer advice, was we commissioned further work from Mott MacDonald to look at the other 5 hospitals to assess the extent of the RAC. Often RAC is quite concealed within a hospital. It requires significant work to fully understand the extent of the problem. So we commissioned more work. Once we got that report and it determined for the 5 that we brought into the programme that they needed a full replacement, that's exactly what
but the Department of Health,
so in line with...
Sorry, but the Department of Health warned you. I'm saying that the Department of Health said to you back in 2020, we need 7 hospitals. That's turned out to be correct. You might have done a further report, but they said, or you can tell me they didn't. Did the Department of Health come to you in the Treasury and say, we need 7 hospitals rebuilt?
No, the Department of Health came and said they had a 40 hospital programme and set out the priorities within that, because of course
did that include 7 hospitals as a priority?
Well, if you let me answer, the needs of RAC need to be balanced across issues in terms of asbestos, issues in terms of wider maintenance, areas where there's demographic growth and there's increased demand. We've invested significantly within the NHS Capital Programme. We're spending over £4 billion a year. This government's got the biggest ever in the history of the NHS investment into the NHS estate, over £20 billion into the replacement programme. But of course it's right that we commission expert engineers through McDonald to do a detailed study of the extent of the RAC to understand whether what is required is a replacement.
But did they say it was a priority? You've answered the question. You've given the positive side. I'm just asking the question. Did they say to you these 7 hospitals are a priority or not?
They said that there were 7 hospitals
Right.
where there were issues with RAC, and that is why we commissioned McDonald to do the further study to understand the extent of the problem. That is what we did as part of a 1-year spending review. We brought 2 into the programme. We commissioned McDonald's to do a further study, and then as the evidence was built around the extent of that, some schemes we've already acted on. 3 hospitals have already had the RAC removed, but they didn't require a full replacement of those hospitals. So it's about looking at what the evidence is, acting in accord with the Institute of Structural Engineers. That's exactly what we have done, and it is part of the biggest ever investment in the NHS estate, over £20 billion, as part of our commitment to the NHS.
You've got to go, Steve Barclay, but quick question for you. Theresa May's book's out today. Are you going to be reading it?
Of course.
Of course, very straightforward answer there. Steve Barclay, thank you for joining us.